as I was getting ready for this today, and I was thinking, wow, we have a lot of people scheduled to come, and I was really grateful for two things, continuing the basketball trend, that we didn't start at 8 in the morning, and that we were not competing with the parade that is on Thursday. So thank you all for being here. I'm Jen Talansky from Nonprofit Finance Fund, and as David mentioned, it has really been a great, great journey, and David and Ian Galloway, wherever Ian is, Ian right over there, and Laurel Gord have been tremendous, tremendous partners, and I have really enjoyed the journey. It's been fun, it's been thought-provoking, and we're looking forward to continuing it. So I am grateful to all of you for also sharing your perspectives on outcomes and outcomes-based financing. We found the information that you shared when you registered really interesting, and we thought you might find it interesting as well. America can't make progress against its most pressing social problems with current solutions. We need a new approach, and we're here today to talk to you about one such approach, outcomes, and using our limited resources to fund based on outcomes, which goes beyond just pay for success. We think that this is a timely and interesting approach, and apparently many of you do as well. 57% of the people who registered for this event said that they are very or extremely likely in the next 24 months, which is a pretty short timeline, to participate in an outcomes-based funding initiative. And perhaps not surprising, since you all signed up to be here today, 63% of you think that this is very important. Outcomes-based financing and funding is very important for your sector. So who are we? We're here from 10 states. Just under half of us are from nonprofits. There are many other groups here that support social services and the social sector, foundations, CDFIs, government, private investors, and more. Many of you serve communities through more than one type of work, and the numbers don't add up to 100%. People could select more than one answer. Those serving the nonprofit sector as a whole, education and youth development, and health had the highest representation. Why do you think outcomes-based funding is important for your sector? The greatest reasons cited were for mission success and effectiveness, a desire to put resources towards what works best for clients and communities. When it comes to outcomes-based funding, what are we doing right now? We range from 18% of us who are not involved with outcomes-based financing or funding at this point to 15% who are currently leading an initiative. They're represented among us here today, people who have real current engagement with outcomes-based funding as funders, as investors, as service providers. This is real. It's happening on many fronts, as you'll hear from some of our speakers and also read in the book. What are our current practices around data collection? Because we need data collection in order to be able to do this. Almost everybody who registered is collecting some data on their programs. 58% of us are collecting outputs data, which is a great starting point. Nearly half are using data to adjust how they serve. It's tremendous. It's not just data for data's sake. It's data to do more or to do better. Measuring, using, and funding based on outcomes can be a win-win-win. For those of you who fund social services, it's an opportunity for you to know you're making real progress on the issues that you care about with your dollars. For those of you who are service providers, when you are funded according to outcomes, you are freed from a focus on compliance and process, and you can really focus on what you know works, and you can innovate when needed. And for clients of nonprofits, clients benefit from services that are aimed at making long-term improvements in quality of life rather than temporary fixes. 63% of you said that outcomes-based funding is very important for your sector. So why isn't everybody doing it? It's not easy. It's not easy to make such a major systemic and cultural shift, and I highly recommend you check out Zia Khan's chapter in the book on change management. It's also important to note this is not without risk. Orienting around outcomes creates a different kind of accountability. This word cloud reflects how you answered the question, what are the main barriers preventing you from participating in outcomes-based funding? I think the words that come up most frequently speak for themselves about where those barriers really exist. Yet despite the barriers and risks, you are not giving up. In your own words, this is why some of you chose to join us today. You came to learn more and perhaps to engage differently. We hope that today encourages you to continue down this path while recognizing it's not going to be quick, easy, or linear, and that this book, website, and everything this campaign produces will be a resource to you on your journey. Thank you very much. I now want to introduce Antony Bugg-Levine, the CEO of Nonprofit Finance Fund.
Thanks so much. Thanks so much. It's really great for everyone to be here, and just wanted to reiterate how much we appreciate those of you taking the time to be here today. We know you're all busy. Those of you who are watching live, hi, Dad. And just want to take a few minutes. We at the Nonprofit Finance Fund, actually, I'll get up here. We basically do three things. We provide loans to incredible mission-oriented organizations, most of which are nonprofits. We provide consulting services to help those organizations and their funders more effectively use their resources and understand how to connect the resources they have to the mission outcomes you're creating. And many of you in this room are our clients. And the third thing we do is promote ideas like this that we believe can help accelerate the pace at which we create a more just and vibrant society here in the United States. And in that work, we're incredibly mission-driven, but we only get to make a difference when our phenomenal partners and clients succeed. And so it's a real honor today to be here with many of our partners and clients. And I just wanted to spend a few minutes before we get to the real news, which is hearing from them about what this all means and how it works. And so I just want to take a few minutes to talk about what we mean, and really just reflecting on the video and those general themes, and specifically what we've observed in our work with many of you about what it's going to take to create a system that can orient around outcomes in order to achieve better results for the communities we serve. So the first thing I'll say is, for us, this is what an outcome is. Incredible organization, Nurse Family Partnership, whose work around the country is creating a dynamic in which more young mothers are able to be thriving in their own lives and have children who are set up for success. Incredible organization that has oriented around outcomes, wrote a chapter in the book about what this meant for them in terms of how they organize their funding. Oriented around outcomes, this is an incredible organization we're very privileged to have supported with a loan in New York City. Again, their founder who helped us on the video. They are outcome center in many ways in that video. And in New York City, there are now people whose lives have been put on a path where they will be able to be successful and thriving because of the services they received at an organization who really envisioned their work as not simply filling those beds and getting paid, but setting up their clients on a different trajectory. So when you hear those stories, you might ask, well, what's the point? I mean, we're all mission-driven people, and of course the point of a homeless shelter is to end homelessness, and of course the point of an organization like Nurse Family Partnership is to make sure that those young mothers and their babies are set up for a better life. But the reality is that's not how we currently organize our system, as we heard about in the video. The funding that flows to your typical homeless shelter or a program like the Visiting Nurse Partnership, it pays for these outputs. If you're running an early child care center, you're paid to take care of the kids. You're not paid necessarily on whether those kids have a better life. If you're, as we mentioned, running a health center, you're paid for the number of patient visits you are able to achieve, not necessarily for those patients getting healthy. If you run a homeless shelter, you're paid to be, as Muzzy Rosenblatt from BRC says, you're paid to be in the hotel business, not the ending homelessness business. You're paid to keep those beds filled. And in general, we are solving problems for the short term, not for the long term. So while the deepest aspirations of everyone in the system, and we know this at Nonprofit Finance Fund from our client work, we know that when we sit down with our clients, and we do this in the basements of churches where they might have a pop-up clinic. We do this in these busy early child care centers where we're all sitting on little desks, on little tables that are this high. We know that when you speak to people about their ultimate aspirations, or the funders, government funders and the private foundations who fund these organizations, our deepest aspirations are to achieve these outcomes. But that's not the way the money flows. And if you were an alien and you landed on Earth and you observed the system and you didn't know anything, you said, what do you think all this money is trying to do? You would think, oh, well, it's trying to create these outputs and activities. There's no link. We're not creating the link we need to the outcome. So one more Golden State Warriors metaphor. Congratulations, by the way, Golden State fans. What would an outputs-oriented funding system be for the Golden State Warriors? Well, you would have one funder who would say, I'm going to pay you for making sure that Kevin Durant 10 times a game drives down the lane. And another funder is going to say, well, I'm going to pay you for every 14-foot jumper that Steph Curry shoots. And Steve Kerr would basically spend his time filling out paperwork to make sure that all the funders got what they did because they've been paying for those activities, and he has to prove to them that his team has been doing those things. He certainly would not have had time to work with his players to figure out that actually having Steph Curry run down the floor, pull up outside the three-point line, and take an open jump shot is a way to actually achieve better outcomes. Now, in that case, the outcome is winning championships, and it's clear. But what we've created is a system that makes a lot of sense, which is we are organizing resources in order to achieve that outcome and giving the players and their coaches the freedom they need to innovate to figure out how to make that outcome happen. Now, that's funny. And certainly if you funded the Golden State Warriors in an outputs-oriented way, they would not win games. And it's funny to us to even think about that. But there's nothing funny about taking something that's so obviously flawed and forcing the people doing the most important work in our society in some of the most resource-constrained settings and giving them a set of constraints that we wouldn't even give a basketball team. And so a lot of this work is about saying something that is so obviously a better way of working in one setting, we would hope could also be a better way of working in addressing the most important problems we face. Now, of course, the problem with that metaphor is that social change is more complex. Poverty is a lot more complicated than figuring out how to win basketball games, as hard as that is for everyone else these days. And so I just want to talk about what it's going to take. We have a system that is not oriented this way. So what is it going to take for us to orient around this new way of working? And then we will be hearing throughout the rest of the afternoon from various people who are working on these various parts of the system. The challenge with orienting around outcomes, which the book explores and this campaign is about, is that these are the 5 essential participants in this system whose behavior is going to have to change for us to create a new system. So let me just go through those in turn. The first are service providers, and you're going to hear from some of the most amazing and inspiring service providers. And I know around the country, when we go around the country at Nonprofit Finance Fund, in every city we operate, there's some service providers, the nonprofit organizations, the homeless agencies, the health clinic operators who are already doing this and are, despite not being funded to do this, are stepping up to operate in an outcomes-oriented way. Effectively, to be effective in an outcomes-oriented way, we are expecting service providers to move from tracking outputs to managing results, from focusing on compliance and all the infrastructure that's been built up around compliance to being able to develop the muscle to innovate and innovate effectively. And then from doing one small part to owning the problem. In New York City, Bowery Residents Committee said that our goal is not just to be a hotel, it's to end homelessness. They observed that many more people leaving their shelter were coming back within a year than had previously happened. Realized the reason that was happening was because we had abandoned housing vouchers that were subsidizing housing for people leaving the shelter. And as you guys do, we in New York City have a housing crisis related to affordability. And they said, well, if the point of us is to be organized around the outcome of ending homelessness, it's not good enough for us to say we run a great shelter if people are landing back in homelessness because they can't afford housing. And now Bowery Residents Committee has become a low-income housing developer. Because owning the problem means if you've observed what is preventing that outcome from being achieved, you've got to be part of solving it. The challenge with owning the problem is often you can't do that on your own, and it forces people into complex partnerships that are difficult to do under any settings, and even more so under the resource-constrained settings where you're trying to deal with your compliance burdens along the way. So service providers have to change. Government's going to have to change for a whole set of reasons. It's a lot easier to pay for activities than it actually is to pay for results. It's easier to ensure compliance and to assess performance. And frankly, it's easier for the government to say, hey, we told these organizations exactly what to do, rather than saying we took your taxpayer money, we gave it to organizations, and we let them have more innovation. And so the fundamental role of government has to be one from control to collaboration and setting the terms of what are the outcomes we want to achieve as a society and resourcing them. But it's very difficult for government to do, and it's a challenge around the politics, not just the technical aspects of making that happen. Private donors, and we are about to have a panel with 2 of the most effective private donors we know. That's why we guys are here. Thank you guys for joining us. But there's a really fundamental change from program grants. I used to be at a foundation. It's quite easy to give a program grant and set a budget. It's a lot easier to say what is the full cost of actually delivering those outcomes on a sustained basis. And I know Fred and Fred have a lot to say on that. From a technical perspective, when you run a foundation, you can get good at project budgeting. It's a lot harder to understand the financial health of these organizations you're supporting and to give them flexible funding as opposed to restricted funding. So we're asking that system to change as well, and that includes leadership, boards, and a whole way of working. And then finally, there's a new role for investors. At the Nonprofit Finance Fund and Nancy's organizations, we lend to organizations who, frankly, get contracts that are outputs-based. When we made that $2 million loan to the Bowery Residents Committee in New York, we know as long as they keep those beds filled, they'll get paid by the state and we'll get repaid as investors. That's financing an outcomes-based way, outputs-based way. In an outcomes world, they'll only get repaid if they actually get people out of homelessness. So as an investor, we have to develop a different set of skills to figure out who is most likely going to take our money, be effective at generating those outcomes that are going to get them repaid so that we can get repaid. You're asking investors to understand something more than just the effectiveness of an organization to execute a project. You're asking them to understand how that project execution really delivers long-term outcomes. We're asking investors to go from financing transactions to financing partnerships, because this is going to be long-term and more complex. And in many ways, we're asking them to go from being a provider of capital to a real partner in helping these organizations work. So that's just at a high level what we're requiring of the people in this room and many of you watching. There's also an important element about what we're going to be requiring from the communities and the clients we serve. Because on some level, an outcomes-based system is going to be a little bit more intrusive. The fact that we are going to ask that homeless shelter, not just did you keep your bed filled, but did you help someone get out of homelessness, means we're going to have to find out what happens to that person after they leave the shelter. If we're going to ask an early child care center to prepare kids to be successful in life, we're going to have to find out whether they are or not. And so there's a role in which data and tracking data is going to be very important in this, and we're going to ask different people to participate in a different way. And for someone who is getting these services, it can be quite intrusive, and we have to be very careful about how we think about the implications for privacy rights and other aspects of how we monitor people. At the same time, it also has a huge potential to be able to offer holistic services to someone, rather than having someone show up at that shelter and then have a different service provider providing mental health care and a different service provider providing support with substance use disorders. In an outcomes-oriented way, if all those are really going to set someone up for a better life, we'll be able to provide them in an integrated way. And at the end of the day, as much as outcomes are intellectually fascinating to us, this is really the constituency that we're here to serve. It's the people who we believe, through this new approach, can actually get much better results for the communities we care about. So just want to end it with that. And the last thing I'll say is many of you have heard a lot about pay for success and social impact bonds, and we are going to have a panel to talk about that. But the transition toward outcomes is far more exciting in terms of the way that we can promote outcomes. In the book, we explore various ways. What if we did something quite simple? We just paid for performance. What if we had that homeless shelter paid not for a certain amount of money for every night they spend with a bed filled, but we actually paid them for the number of people who were no longer homeless a year after being in that shelter. That's a pay-by-results contract. It's a great way to fund and finance outcomes. But there are other creative ways that we talk about in the book. Something called advanced market commitments, which has been applied in international development and global public health. Simply saying to anyone out there, there's something we value as a society. An example we have in the book is to reduce gun violence, we really need guns that are fingerprint testable, so that only someone who has a certified fingerprint can fire the gun. That gun gets in anyone else's hands, doesn't fire. Well, it turns out there isn't a private sector market that is lucrative enough to entice people to want to pursue the research to get that product to market. An outcomes-oriented way of solving that problem might be to say that we will commit, as the government, that every police department in the country will buy a certain number of these guns at a set price and buy them from whoever can make that product work. That's an advanced market commitment, and by putting that funding out there, you're saying to someone, if you achieve the outcome, there'll be a reliable way for you to get paid. We also talk about prize competitions. Out here in Silicon Valley, a lot of you are excited about the X Prize. We actually have the X Prize Foundation write a chapter about that as an outcomes-oriented approach. What if we said that there's a $10 million prize to the first organization that can figure out a reliable and repeatable way to get people who are very poor, pre-diabetic, a set of services that prevent them from having diabetes with all the expensive and awful human implications of that disease manifesting itself. An output-oriented way would say, we're going to fund this nonprofit to do a set of activities in the community. An outcomes-oriented way might be to say, let's just put a $10 million prize out there. If you can prove that your organization knows how to do this and do it well, that prize will be available to you. And we'll talk about pay for success as well. And the last thing I'll say about outcomes-oriented performance, it's not just how do we fund nonprofits, but there's a fascinating example in New Zealand, for instance, where the outcome that was being sought was a reduction in the number of people who go to prisons, leave, and come back, recidivism. In New Zealand, the federal government said to the architects and engineers building a prison, we're going to pay you for the outcome of people who come into this prison leave and fewer of them come back and recidivate. In that case, the outcome is one that's not just being imposed on or made available to the nonprofit organizations. You're going all the way upstream and saying, we'll actually ask you to design your prison physically as an engineer and an architect with this ultimate outcome in mind. What that meant was those engineers and architects started sitting down, not only with the prison operators, with the people who had been in those prisons, and figuring out how we, again, can organize all of us in society around these goals and not simply make this something that we're imposing a nonprofit organization. So that's the opportunity. We're really excited to hear from our panelists today about what it's going to take to make it real. It is much more complicated than simply fielding a winning basketball team. But one thing I'll say is I anticipate meetings in Oakland on Thursday and the parade. Imagine the parade we could have if we actually got this to work. Imagine that parade we could have when we massively reduce homelessness, when we remove racial disparities and the opportunities available to young children. It's complicated, but it certainly seems worth doing. And it's a real honor to be here standing with all of you as we seek to do this all together. Thank you.